Welcome back to Midday. We are joined by Dr. Bob Rishiraj. Of course, he is an oral and maxillofacial surgeon. So thanks for being here.
Thank you.
Dr. Rishiraj, we're talking, we talked wisdom teeth last time you were on the show. This time we're talking dental implants. So first of all, my question to you is, how would you explain what a dental implant is?
Dental implant is a substitute for a tooth that has failed.
Okay.
It's one of the best options that we have. In the past, there were bridges that were done. Mm-hmm. Bridges are still an option, but the main gold standard that appears to be appearing is an implant. An implant basically is a single entity that provides function for a patient.
Right.
It's independent of other teeth around it, so it makes very good sense to consider an implant as an option.
So you mentioned bridge is still an option, but when would an implant sort of trump that and be the only way to do it?
It's not. It's never the only way to do
Okay.
it. It's the problem is costs are an issue, and insurances don't cover implants. Even to this day, there's only one insurance locally that covers it. So a lot of people say, you know what, I cannot afford an implant, and it may be the best choice because you're not harming any other teeth. The implants, as I said, are independent entities,
Right.
and replace a tooth that's missing, whereas a bridge basically involves two or more adjacent teeth to fill the gap of where the teeth are missing.
Okay, so I want you to explain the process, Dr. Rishiraj, but I know we have a couple of x-rays here. Maybe we can put the first one up. Talk a little bit about what we're looking at here.
So what we have here is a patient who has had multiple implants. Now you'll see the x-ray shows teeth that have sort of long, spiny roots and white structures in them. Yeah. Those are root canal treated too. So this gentleman, who is actually a patient of mine, has had multiple teeth fail, and we've had to replace those teeth with implants.
Right.
And as you can see on the bottom jaw, there are 3 implants that have 3 teeth crowns placed to restore function. In the upper jaw, he's had multiple implants as well. Right. So in this case, we are doing implants in the teeth that are missing or potentially going to be have poor prognosis. So it really depends on the patient on what needs to be done, but in many cases it is really an ideal treatment choice for a patient.
Okay. We have another x-ray that maybe you can walk us through as well. I find this quite interesting as well.
Yeah, this one is fascinating.
Are there happy faces on there? Is that what that is?
They look like happy faces. Yeah. What it is this gentleman was edentulous. That means he has no upper and lower teeth. Now there is one tooth that's impacted on the lower right.
Right.
We decided to leave it alone because it's close to the nerve that we talked about last time about wisdom teeth. So in this case, we are able to provide a patient a lot of retention for a lower denture. The lower denture becomes a problem for a patient who does not have any teeth because the lower jaw is very flat and thus minimal retention for a denture. So the denture basically flops around.
Right.
Where if you put implants in strategic places in the lower jaw, you can anchor the lower denture to the existing implants, which allows them to function pretty normally.
Wow, that's amazing.
It's,
so this is something you see a lot, I'm sure.
Yeah, we see cases ranging from one implant, because let's say a hockey injury.
Yes.
Right?
Yeah.
Hockey injuries happen a lot, and other injuries, but one tooth where it's a front tooth that needs to be replaced, but other times we have what we just saw on the x-ray, they have no teeth.
Yeah.
Multiple teeth, everything is gone.
Yeah.
Right? So the range is very variable, and it depends on the patient's need, and most importantly, it basically goes down to function. if they want good function, the ideal really is implants.
All right. Well, thanks, Dr. Rishiraj. And of course, speaking of dental implants, Dr. Rishiraj holding a dental implant seminar, a free seminar at your office, right?
Correct.
And that is happening on November 30th. So just if you want to find out any information about dental implants or ask Dr. Rishiraj any other questions, that would be a great time to do it. We're back in a couple of minutes. Stay with us.